No mai haere mai, welcome to 3 News. An 11-year-old child who was wrongly identified as a missing patient aged in her 20s was taken to a mental health facility by police, handcuffed and injected with antipsychotic drugs. Health NZ has apologised for the incident, saying it was investigating the traumatic experience alongside police. And as senior political correspondent Jenna Lynch reports, the Prime Minister is calling for accountability.
When members of the public saw what they thought was a young woman in her 20s climbing onto the railings of this Hamilton bridge early in the morning, the obvious call was made to police.
And she climbed up onto the railings. They had concerns and fears for her. They contacted the police responded. Apparently they launched a boat into the river. They managed to recover her.
But the woman on the bridge was not in her 20s. She was an 11-year-old, non-verbal, autistic child.
The police have been trying to look after her. Right from the initial call that they got from the public, all the police's motivation, all they've been trying to do is care for this young woman.
However, after getting her safely away from the danger of the bridge and to Waikato Hospital, she was handcuffed and injected with antipsychotic medicine.
That is incredibly distressing and incredibly concerning. Obviously there was a misidentification that happened there between police. There is now a health inquiry going on and we need to really get to the bottom of that. That is incredibly distressing and worrying.
It was a case of mistaken identity. A 20-year-old patient had gone missing from the Henry Rongomo Bennett Centre, the mental health facility at Waikato Hospital. The police minister says police checked with caregivers there to confirm the identity of the woman they picked up.
She was misidentified and she was dropped off at the Waikato Hospital.
By who?
Well, I don't know the exact details of who that was. Someone that was purportedly knew the person that was missing.
Health officials not known that a 20-year-old and an 11-year-old were different?
Yeah, that's a good question. Clearly not acceptable. I think it's every parent's worst nightmare.
Police handed the 11-year-old over to hospital staff, telling them they believed she was the missing 20-year-old.
They asked for the caregivers who identified her, I assume on the phone to them, to meet them at the hospital to ensure that they had the right person.
I'm not in that much detail.
Would you expect them to do something like that?
I'd expect them to do all that they can.
By 6 o'clock that evening, the 11-year-old girl's mother raised the alarm that her daughter was missing, and the penny dropped for a police staff member, recognising the girl as the person they'd picked up from the bridge.
As a parent, you identify with what is a horrific set of circumstances that has happened, and it's just incredibly distressing and concerning. Massive amounts of empathy and concern for her and her family.
It's unacceptable what happened. We're expecting a full investigation to be fully briefed on what took place.
Health New Zealand is leading a serious incident review.
My expectation is that review is done timely and we should have the results by the end of the week.
Is there a formal review happening into that identification process?
There's a formal review happening that's been led by Health, and police will be a part of that without a doubt.
The health and mental health ministers were both kept in the dark by officials, first made aware on Friday, nearly 2 weeks after the incident took place.
Once we had a media query come to us, we then raised it and we were then provided a full briefing of what took place.
Unacceptable.
The PM saying he expects to see some accountability.